Hello, everyone. In this video, we're going to take a look at what a DXA scan is and why it's used so much in both healthcare and research. A DXA scan is a quick, low radiation test that shows us how much of the body is made up of bone, muscle, and fat. It's actually one of the most accurate tools we have for understanding body composition and bone health. We'll talk about why DXA is so widely used and what makes it useful and what you'll be able to understand by the end of the session. You'll learn what the scan measures, how to read the images and numbers, and how to make sense of the results in a simple, practical way. And just to address safety right up front, DEXA uses a very low radiation, so about the same amount you get from a natural background exposure in a day. So it's considered pretty safe and routine. DXA, or dual energy X-ray absorptiometry, is a type of body scan that shows how much of your body is made up of bone, muscle, and fat. It has been used in clinics since 1998 and is considered one of the most accurate way to measure these components. So this scan uses two very low dose X-ray beams, and by seeing how much of each beam gets absorbed by the body, the machine can tell the difference between bone, fat, and lean tissue. The scanner has a moving arm that passes over the body and a device that shapes the X-ray beam. Along with this, it has a sensor that picks up a signal, and then finally a computer software that puts everything together. So even though the technology inside it's complex, the idea is simple. Different tissues absorb X-rays differently, and the machines use the information to separate them. So a lot of this PowerPoint is going to sound scripted because I grabbed a lot of information and I want to just make sure that it is correct and accurate. But in personal experience, I was able to do a lot of DEXA scans while at Virginia Tech. We use the same system. There are different brands, but they do just about the same thing. So when I explained it to the students who I did DEXAs on, we would sit down and have about a 5-minute conversation about what they were required to do. And this is going to be addressed later in the presentation, but what was expected of an individual is that they lie out as still as possible on the scanner or underneath the scanner on what looks like not a hospital bed, but it's pretty flat, not very comfortable, and it's in a room full of fluorescent lights. So the person is going to lie out as still as possible within certain boundaries. The boundaries are within a rectangle about 6 feet long and maybe 4 feet wide. So we position the individual within that scanner, and it allows the C arm, or that like moving arm that passes over the body. It is called a C arm. It moves very slowly over the body and it takes about 7 to 13 minutes. The person on the bed is going to lie out as still as humanly possible to make sure that the scanner gets everything accurate. What can make it less accurate is, again, movement and metal on the body. So another thing we had to explain before scanning somebody is that all forms of removable metal needs to be removed. So like earrings, necklace, watch, glasses, they had to take it off, not because it would kill them to have it on during the scan. It would be to make the scan more accurate. So that was a really fun experience. And what we got from that, and this is why we have the computer most of the time, what we get from that are two sheets of paper that tell us a lot about what's inside the human body. And so later on in this presentation, I'll also explain some of that. So this should be pretty exciting, but I just want to preface this with some of this is going to sound very, very scripted because I don't want to give you the wrong information. So a DEXA can measure how dense your bones are. And this is really important in clinical settings. A lot of times DEXAs are done to look specifically at bone mineral density, especially with individuals who are really at risk for something like osteoporosis. The older you get, the more coarse your bone, not coarse, the more porous your bones are going to be. And we like to track that because you don't want to get that to dangerous levels. So women who have a history of low bone mineral density or who are pointing towards osteoporosis will most likely get these scans in a clinical setting. This DEXA is very good at telling us how much mineral is packed into your bones. And that's what bone mineral density means. It can also show us how your body is built. So muscle and fat in different regions of the body. The information we get from the computer is very, very dense and detailed. So it's really important when you get the scan to ask your provider to explain certain components with you. A DXA cannot measure how thick your bones are. So DXAs look at the bone from above like a shadow. It can't tell how deep or thick the bone is. It just shows how dense it appears from that angle. So we need to be careful with our interpretation of that. So there are four types of DXA scans, and this scan can show how different parts of the body look specifically. So the forearm gives a really specific view. The lumbar spine and the hip are also very important. But for a lot of reasons, I prefer to do a whole body DXA scan and explain all portions of the body, especially in educational settings. The lower back or the lumbar spine and the hip are the most common places to scan for concerns about bone mineral density. And because these areas tell us the most about bone strength, and they are the best for tracking changes over time. So when we're looking at the older population, it's good to know how your bone mineral density changes over 10 years. The forearm is scanned when the hip or spine can't be scanned, so it's not a very common test. And then a whole body DEXA looks at everything at once. So it gives us bone mineral density and body composition. And you can really use these to track your fitness or how your body changes over time in response to certain workout regimes or regimens. I apologize. So you may qualify for a DEXA scan if you are a man above the age of 70 or a woman above the age of 65. You can also qualify if you're a woman younger than 65 with certain risk factors. And also, if you have osteopenia or you've had a lot of fractures in the past, this is a great reason to get a DEXA scan. So, in addition, some long-term medications can impact your DEXA, not your DEXA scan. It can impact your body in ways that we need to track. So it is also a good idea to get scans with medications that affect bone mineral density, along with certain disorders that affect bone mineral densities. These medical conditions include hormone-related issues, kidney problems, certain autoimmune conditions, eating disorders, long periods of limited movement, and a history of gastric bypass surgery. As far as long-term medications, long-term steroid use, and seizure medications, hormone blocking medications are also suggestive of needing a DEXA scan just to track your health over time. So children should also consider, or the parents of children should also consider getting a DEXA scan if they have the following factors going on in their life. Nobody's going to just take a DEXA scan for a child just because. So they're used very carefully. Children have not risk. Children are more likely to move around during the scan, so it's not really encouraged for children to get a DEXA scan unless these four different situations are experienced. A common situation is long-term steroid treatment. Steroids can slow down bone development, so it's a good idea to track it using a DEXA. DEXA can also be helpful for children who've had radiation or chemotherapy because this also affects how strong the bones become. And then certain hormone-related conditions like issues with growth hormone or thyroid function really suggest that a DEXA scan needs to take place just to check the health of your child on a body composition level. So for contraindications and limitations, there's no absolute contraindications that we found in research, but this should be avoided during pregnancy because even though the radiation you're going to receive from a DEXA scan is very, very low, we love to take precautions. We don't want anything at all to put the child at risk during pregnancy. So we try to avoid it. And a good way to avoid doing this during pregnancy is to take a pregnancy test before the DEXA scan. Another contraindication or limitation is recent GI contrast studies or severe degenerative changes. That was very difficult to read, but some severe degenerative changes will kind of make your observation of changes over time more inaccurate because it is extreme. If you come in one day and your bones are healthy and a week later they're not, it's not a good idea to use the scan as a tracker of change. We prefer, or I would prefer to do this over like a 3 month period, a 6 month period. If you have implants or hardware, this is a limitation to get an accurate DXA scan. It's still considered the best of the best methods to get body composition explored, but metal does make it a little less accurate. And also, movement during the scan can really truly limit how well we can interpret the results because the scan's not able to catch the body composition or the composition of your arm if it is moving all the time. And yes, I demonstrated that on camera. So I believe in slide 2, we talked about how to prepare for a DXA scan, how you're supposed to lie flat on the table, and how it takes about 7 to 13 minutes. And so I won't really go over this again, but as a note, for women who have not gone through menopause, a pregnancy test is usually required to, again, like take precaution. So the upcoming 5 or so slides, I want to show how to interpret a DXA scan. Um, bone, and I want to lead into this with talking a little bit more about bone mineral density. So this may be a little bit scripted. Fasten your seatbelts. So bone mineral density is a way of describing how strong or fragile someone's bones are. A DXA scan measures how tightly packed the minerals are inside the bones, which is why this is so popular for looking at bone health. So this also helps show whether the bone can handle everyday stress without breaking. Doctors use this number to determine whether someone has normal bone strength, early bone loss, or osteoporosis. And this is when the bones have become thin and more likely to fracture. And we can't have that now, can we? Because bone strength is only one part of fracture risk, clinicians can also use the FRAX, FRAX tool, which determines the chance of breaking a bone in the next 10 years. And a DXA scan can also provide this. So together, bone mineral density and FRAX give us a clear picture of a person's overall bone health. So make sure you check that out in the future. Your DXA scan, oh, skipped a slide. Your DXA scan, once it's looking at your bone mineral density and body composition, is going to give you a T score and a Z score. So I want to very quickly explain what those are. So when you see your own DXA scan, you understand what they mean. So a T score describes how far a person's bone density is from the average healthy young adult. And it's measured in standard deviations. So make sure you check out some elementary statistics later. It's used for peri and postmenopausal women and for men over the age of 50 because this is the group where age-related bone loss becomes clinically meaningful. So a T-score between negative 2.5 and negative 1.0 indicates osteopenia, which means bone density is lower than normal but not yet in the osteoporosis range. A T-score of negative 2.5 or lower meets the definition of osteoporosis. So we need to be careful with this. This is where bones have become thin enough that the fracture risk is significantly increased. What you'll also get from a DXA scan is your Z score. A Z score shows how a person's bone density compares to what's typical for someone of their own age. And this is measured in standard deviations. It's used for children, adolescents, premenopausal women, and men under 50. So the T score is for peri and postmenopausal women and men over 50, and the Z score is for everyone else who's younger. So with this score, we look at this population group because their bones are still developing or they haven't begun the age-related decline. So when a Z-score is a negative 2 or lower, it's described as below the expected range for age. And so this means that the person's bone density is significantly lower than what we would normally see in their age group, and it may warrant further evaluation. So I'm going to be talking specifically about whole body DXA outputs because I've had the most experience with that, and this is what I'm most interested in. For more information about the lumbar spine or the hip, you can drop something in the comments. I'm sure there's other research out there, but I really prefer talking about the whole body DXA scan and what we can get from that. So what we get from a whole body DXA scan is measurements or estimates of your fat mass, your lean soft tissue mass, your fat-free mass, your soft bone tissue mass, and your total body mass, so like your weight, and your percent body fat, which people are very interested in looking at, especially if you're an athlete trying to hit a certain threshold or if you're in a weight loss intervention. This is one of the what people think is the coolest measurement to get from a DXA scan. And what you also get from a DXA scan is your bone mineral content and average bone mineral density. So while looking at your percent fat mass is really cool, I really prefer to dive into your bone mineral density just because you're going to peak with that at around age 30, and from there you're going to hit a plateau and decrease over time. So that's really important to me to make sure we check and see if that's at a healthy range. So, and again, this part may be scripted because I want to get this as accurate as possible, so I'm not steering somebody in the wrong direction. But when you look at a DXA bone density table, each each row represents a different region of the body. So your head, arms, legs, trunk, ribs, spine, and pelvis, which is really, really cool. This each column gives you a different piece of information about the region. So the bone mineral density column shows the actual bone density number measured by the scan. And the T and Z score columns compare that number to reference groups. And so that information was explained in the last two slides. And it's really just shown at like the bottom of your bone density report. So as in this example, you can see that the T score is 0.2 and the age match Z score is 0.9. This visual helps people understand the numbers at a glance. And we kind of pair this with a table. So this very colorful table, including the colors dark green, light blue, yellow, orange, and red, kind of puts your bone mineral density up against people in your age group, and it looks at this potential change over time. So this individual is between 20 and 30 years old, and her T score shows, and this is going to be this black dot kind of towards the top of the left corner. This shows that she is above average in her age group or at the highest point of average in her age group. So this light green line that goes across the table, that's going to show you your average. And if you're above that, it's going to look green. And if you're seriously below that, that's going to be a very hot red. Um, and let's see. Okay. So moving on to the next report, a whole body DXA scan table uses columns to show how the machine breaks the body into different components. So we had a really cool visual of what your body looks like in black and white. If we want, we can also show you a color visual of that showing, and I can bounce back to another slide. Showing here, the orange is going to be your estimated fat mass. When it becomes red, that's suggestive more of muscle, and your skeleton is going to be light blue, light to dark blue. And so that's really cool. And if you do have metal on your body or within your body due to some sort of replacement, we'd be able to identify that as well. And it will pop up very white, almost silver looking. So that doesn't mean anything's wrong. It just means we can see it on the scan. So back to this slide. The tissue percent fat column shows what portion of each region is made up of fat, while the tissue mass column shows the total amount of tissue in that area. So fat and lean mass separate the tissue into fat and non-fat soft tissue, and the bone mineral content column shows the mineral content of the bone in that region. Total mass combines all of these pieces. The table also lists right and left side values so you can see whether one limb carries more lean or fat tissue than the other. And a lot of times you can see that the right side of your body or your right limb or your left limb is a little bit heavier than the other. So nothing is really even, which is very, very cool, interesting to see. What you're also going to look at is the android and gynoid rows, and those are going to be seen somewhere at the bottom and kind of at the bottom middle of this overall table, which gives you a lot of information. So if you get a DXA scan yourself, make sure you ask for interpretation from like your clinician, doctor, or provider, whoever's doing the scan. Please ask questions because this is a lot of information on your body. And it's really cool how there are so many numbers involved in who you are. So the android and gynoid rows show the fat distribution in the abdominal and hip thigh regions, and the fat mass ratios summarize how fat is distributed across the trunks and limbs. So the visceral adipose tissue and subcutaneous adipose tissue estimates give us an idea of how much fat sits deep in that abdomen versus just under the skin. And so together, these columns help explain how DXA partitions the body into fat, lean tissue, and bone, and how to notice when one side of the body carries more mass than the other, and then finally how the scan defines android and gynoid regions. So they, and then finally, they also show what the visceral and subcutaneous fat estimates represent and how to describe overall fat distribution patterns in a clear and non-clinical way. Now, when we talk about improving or maintaining bone mineral density, the strongest evidence supports resistance training and load-bearing exercise. And the goal is consistency over time, which means about 3 sessions per week, lasting 30 to 60 minutes, and sustained for roughly 10 months before you see consistent changes. Now, in summary, the big idea to take away from this presentation is that DXA gives us two powerful kinds of information: how strong the bones are and how the body's tissues are distributed. Bone mineral density helps us understand when someone's bone strength sits compared to expected ranges, and how body composition data shows how fat, lean tissue, and bone are arranged throughout the body. And when we look at these pieces together, we get a better or a fuller picture of overall health than we could from just weight or a single number alone. And the DXA scan is especially valuable because it can be repeated over time. And this lets us track changes in bone mineral density, body composition, and this is done in a consistent and reliable way. The goal is to use these measurements thoughtfully, seeing patterns, noticing changes, and understanding what the numbers represent, so that learners can interpret DXA results with confidence and clarity. Thank you so much for listening in and paying attention. References can be found in the description as far as pictures go and articles used. I would like to thank personally the Arizona State University for one of their blank photos of a DXA scan, along with Virginia Tech and their resources as far as examples of bone density reports. All of this is anonymous, but I hope it was helpful. Thank you so much for your attention.